Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Fall and winter is flu season. It's something you and your family should be thinking about. Every year, thousands of Americans die from seasonal influenza or flu-related complications. Our guest today is Dr. Jeff Green. He is a family physician at Mayo Clinic Health System. Dr. Green, thanks for joining us today.
Thank you. Appreciate you having me here today.
Well, let's start out by defining what exactly is influenza, and is it the same thing as stomach flu?
Right. So when patients come into the office to be seen and they say they have the flu, we often have to query them as to what they mean by that. So influenza is also known as the respiratory flu, and by definition then it attacks the respiratory tree, which starts at the tip of our nose and our lips and heads down into our back of our throat and our trachea and into our lungs. And so the respiratory flu is what we mean when we're talking about influenza. The stomach flu, on the other hand, we often term it gastroenteritis. It too is caused by viruses, nasty ones, which tend to hang out on cruise ships and tend to cause stomach symptoms. So we're nauseated, or we'll throw up, we'll run a temperature, we'll have some cramps and some bloating and not feel well. And so today's discussion centers on the flu, but more specifically influenza or the respiratory flu.
So what are the symptoms of respiratory influenza?
So respiratory flu, when we're exposed, it usually takes a couple of days, on average about 2 days, to develop symptoms. It can be as soon as a day after exposure and as long as 4 days. Tends to come on somewhat abruptly. Symptoms sometimes will mimic a cold. We might have some cough, a little congestion, but as respiratory flu progresses, we tend to develop fever, though not always, but often. Have some chills. We might feel hot and sweaty, alternatively cold and freezing. We'll develop some nasal congestion, a sore throat, body aches, generalized malaise or not feeling well as some weakness and some fatigue, feeling like we're kind of wiped out, if you will.
So really, the symptoms often start out seeming like the common cold, but they then get much more severe than a cold.
Exactly. And so we develop those upper respiratory tract infection kind of symptoms, and then they tend to hit us a little harder than the typical regular winter cold kind of stuff.
And unlike the cold, flu tends to hang around?
Yes, so symptoms can last, 4, 5, 6, 7 days, usually peak day 3 or 4, and then as we take care of ourselves, we feel better day by day and can kind of get back to our usual selves after about a week or so.
So what causes people to catch the flu?
The respiratory flu is spread by droplets, and these droplets are produced when we talk, when we sneeze, when we cough, when we also our secretions contain viruses when we wipe our nose or wipe our chin or our mouth or these types of things. Most commonly, respiratory flu is spread by droplet, which is aerosolized when we do these things that we just talked about. It can, not as common, but can be transmitted with secretions on various objects and such.
So how serious can influenza be? Can it be fatal?
Yeah, unfortunately, it seems every flu year on the national news networks we hear about some very tragic cases of influenza-related deaths. It can be very serious. It can also be easily prevented in many cases, and so we'll talk a little bit later in the show about vaccinations. It can be very, very serious. What happens is we come down with influenza, and if we're typically young and healthy and have a vigorous and a robust immune system, we tend to fight it off, and yeah, again, after a week or so, we're back to our usual selves. If we're immunocompromised, so they're very young, or as we age, our immune system isn't quite what it was, we can develop a more severe case of the flu or subsequently secondary infections as our body's normal immune system and means of fighting off disease are weakened by influenza virus. Then we can come down with some of the complications, the most severe of which is pneumonia, which can lead to respiratory failure, which can lead to death when not treated aggressively.
Who's at most risk for developing influenza?
All of us are at risk for coming in contact with people that are shedding influenza virus. So whether we're at home, someone comes home from school or daycare or at work, or we're a healthcare professional, or we interact with the public on a regular basis, those respiratory droplets can be and are everywhere, and so all of us can come down with it. Those that are at highest risk for complications are, again, they're real young. So folks, young kids younger than the age of 5, particularly younger than the age of 2, tend to have more severe complications. Elderly folks over the age of 65 tend to have a harder time with influenza-related illness. Pregnant women also tend to be or can be more severely affected. And those with chronic medical conditions, so folks with COPD, which includes emphysema and chronic bronchitis, folks that have asthma, folks with underlying heart conditions, diabetes, folks who are immunosuppressed, so some of our friends or family members or community members who may be undergoing chemotherapy, being treated for cancer, which those treatments which suppress the immune system, are all at high risk for developing severe flu.
So if I'm experiencing flu symptoms, when should I go see my healthcare provider like yourself? And then how do you treat the flu?
Flu season typically peaks January and February. We start to hear cases in late fall. The Minnesota Department of Health and our good resources on the radio and the TV usually keep us in the loop as to when flu season is arriving. And so if we start to develop symptoms of cough and cold and congestion, some of those common sense measures of staying home from work, using some Tylenol or ibuprofen or Aleve is appropriate, provided those are safe in our individual situations. To treat some of the symptoms is quite reasonable, staying hydrated or resting, as I mentioned. If symptoms continue to persist or we start to develop those more severe symptoms which we referenced, so an elevated temperature, muscle aches, hot and cold sweats, and particularly if we're one of those high-risk candidates that we referenced earlier, seeing a physician or a provider is important to diagnose flu early enough so that we can potentially treat it. When a person comes into the clinic, oftentimes we can make a diagnosis by history. Oftentimes we may use some additional testing measures. If symptoms and history confirm, as well as testing can confirm influenza, then treatment is an option. And so there are some various treatments that we can implement to treat flu. These are antiviral medications. One's medicine by mouth, the other's an inhaled medicine. And these tend to limit the severity of the illness as well as to shorten the duration of symptoms.
We should make it clear, too, that those medications, they don't prevent you from getting the flu. They simply treat the symptoms and the actual virus.
Exactly. These medicines are used to treat folks who have influenza. At the same time, if I have a confirmed case of influenza and I have close contacts within my family and I want to keep them from getting the flu, then we can prophylax family members by having them take a similar medicine. It's a little different dose and for a different period of time to decrease the likelihood of transmission within those close household contacts.
So this brings us to the number one question. How do we prevent the flu?
Influenza vaccination is recommended for every individual over the age of 6 months. And so the CDC used to, in the past, try to qualify who's at the highest risk and let's make sure we immunize them. And what we've decided upon is a strategy of essentially universal immunization. And so immunization plays a key role in obvious prevention. And so we've tried to make it easy for patients to be able to get their flu shot. So even the pharmacies are able to provide influenza vaccines. We also have some outreach programs to some of the larger employers in town where we can go out and immunize patients. So prevention certainly is key. We've also tried to make it easy on patients who may have some issues with needles. Some folks don't like shots. Not too many people enjoy shots. And so there's a lot of different ways to get the flu vaccine. There's an intradermal injection, which just goes into the into the skin. There's the intramuscular injection, which goes a little bit deeper. There's actually a jet propulsion air injector, which has just been made available. And then there's also, for the appropriate patient demographics, an inhaled vaccine, which is actually the preferred vaccine for pediatric patients between the ages of 2 and 8.
And what exactly is the vaccine? Is it are you giving them a small amount of the flu virus?
Yes, and so the scientists, the epidemiologists and the virologists, the smart people who are charged with tracking influenza cases around the world, they come up with a recipe, if you will, of the main characters for active influenza disease for that given year. And then the vaccine makers, they essentially chop up pieces of those viruses, and then we administer them, and then our body recognizes them as foreign and as viruses, and our immune system then goes to work in creating an antibody response. And so the injectable vaccines are killed viruses. And we'll talk a little bit later about how we can't get the flu from the flu shot. The attenuated viruses, or one of the inhaled forms, is a weakened virus. It's weakened so much that it cannot cause the flu. But then those tissues, which are kind of the first line defenses against influenza, become exposed to particles of virus, so that when the exposure happens out in our community activities, our body can jump on it right away and mount an immune response.
So besides the flu vaccine, what are some other ways to prevent the flu? Just common lifestyle things.
Right. So all those things that our moms told us when we were young. In fact, my wife, when I came in to film this, said, "No, whatever you do, don't pick your nose." And so picking your nose is not a good thing. Staying away from our eyes and our nose and our mouth during flu season is a good idea. Washing our hands regularly, using simple soap and water, some of the neat, easy, accessible alcohol-based hand cleaners. Covering our coughs, so when we've got, whether it be the cold or one of the other viruses or the influenza virus, trying to decrease the means by which we transmit that to other people, the old hacking into our elbow, staying home from work when we're sick. These types of things can hopefully decrease the number of folks that come in contact with influenza virus.
You mentioned the covering your cough in your sleeve. Now, obviously you don't want to be covering your cough with your hands, which a lot of people probably do.
Right. So anything that we can do to kind of keep these respiratory droplets from being aerosolized is kind of key. Mythbusters, actually, I think you can probably Google it. They looked at all different ways, hands, handkerchiefs, and putting your hand into your elbow and coughing had the least amount of aerosolization. So that's the preferred method.
All right, so let's go back to the flu shot now. What about people who think that they might actually catch the flu by getting the flu shot?
Right. As we discussed, the particles in the flu vaccine are incapable of producing respiratory influenza. At the same time, sometimes people will have a local reaction or sometimes a generalized reaction to the constituents of the vaccine. It takes 2 weeks to develop antibodies, so sometimes we may have developed a cough or a cold or even come down with influenza when we're still susceptible to the virus. Sometimes we're not very good at matching the strains. And so we get a flu shot, and then over time the virus has changed, and so the immunity isn't quite what we had expected.
So just to be clear, you cannot get the flu by taking a flu shot.
That is true. We cannot get influenza by taking the flu immunization in any of its forms.
Well, unfortunately, we're all out of time, but I'd like to thank our guest today, Dr. Jeff Green, Mayo Clinic Health System family physician, for joining us today on Speaking of Health. A great topic. Thank you very much.
Thanks for having me.
Have a great day, everyone, and be healthy.